Thank you, Devin. According to the CDC, white coat syndrome affects as many as 1 in 3 people who have high blood pressure readings during medical appointments. And here to tell us more about white coat syndrome is Nurse Christina Paris from the VA. So thanks so much. We've missed you, having you around.
Thank you. Thank you. I'm glad to be here. This actually has come about because I've had several illnesses over the past few months. Thankfully, nothing, life-threatening, but have sent me to the ER. And I have to give props to Nurse Eric, the night nurse at Howard Young, because he's put up with me. And but anyway, so
well, we're glad you're here.
I do get nervous when I go to the doctor. So that was what prompted the curiosity into this.
Yeah. So, what is white coat syndrome? Is that an actual thing?
It is an actual thing. They have actually done studies, and it's typically people will go into the doctor's office, their blood pressures will be elevated, but not elevated when they're at home. And they've done these studies. It's a real thing. It's due to typically anxiety. The downside is it can also be kind of a precursor, an indicator that you may have hypertension, true hypertension in the future, which increases your risk of cardiovascular disease, stroke, things like that. So it's something we do take seriously.
So is there something that people can do to kind of combat this?
There are. So some of the things that you want to do that can help you is develop good relationships with your provider. Getting to know them can be a big thing that will help relax you when you get there. Change your providers if needed. If it's not something somebody you're comfortable with, request a change. Bring a list of questions. Be prepared when you go. Make sure you get to your appointment earlier than your actual appointment time. This allows the nurse to check you in, take your blood pressure, talk to you, and get information. Don't smoke, drink coffee, or exercise right before you go into the doctor. And always, you can use deep, relaxing breaths to help you out. Surprisingly, even though I work in a doctor's office, I've worked in hospitals, I am one of those people that get really nervous when I have to go in to the doctor.
Yeah.
So, yeah.
That reminds me of a time I was going to go give plasma, and I was going to give that second donation that you need to. And just something my blood pressure was just really high that time, and then they had me go sit back down, and then I went a couple more times, and every time after that, it was just high. And normally, it's not. I have a normal blood pressure, but I think I was just really anxious about trying to pass that blood pressure thing, that it was raising my blood pressure.
It absolutely can. The more we get worked up about it and the more we think, oh, I've got to settle down, I've got to bring my blood pressure down, the more our blood pressures go up. So yeah, it can be pretty serious.
Yeah. Well, if you're taking your blood pressure maybe at home, and that could probably help relax you a little bit versus a doctor, what's the proper technique for that?
Sure, absolutely. So that is one thing that we will do. So typically if a patient comes in and their blood pressure is high when they're in the doctor's office and they say, really, it's never high at home, we ask them to take blood pressures at home. We want you to take it for a couple of weeks because not just one blood pressure, one
can't be the tell-all.
No, we need to see what it's like. So what we want you to do is always take it in the same arm. You want to take the reading at the same time every day. Don't round up your measures. Take exactly what the readings are. Don't worry if you get an unexpected high reading. Like I said, that can happen. There's so many different things throughout the day, hormones, time changes, medication, stress that can elevate your blood pressures or change them. Don't check your blood pressure too often. So we'll have some people go, well, I checked it, and then 2 minutes later I checked it again, and then I took another reading 5 minutes later. That's not necessary. That's not going to give us any more information than we already have. And then don't stop taking medications, and always speak to your provider if you're worried about it.
Well, that's great to hear. It's certainly difficult to not drink that coffee in the morning. I know I had some lab work done the other week, and I had asked them ahead of time. I was like, "Can I drink coffee?" They're like, "Yeah, you should be fine. Just don't eat." And it turned out all right. I didn't have the high blood. I had a little bit of that white coat syndrome when I was younger, but then as I guess I've grown out of it a little bit myself, just because I was like, well, I'm going there anyway. Let's see what they have to say.
Right. Yeah.
But not a lot I can do about it.
Not getting too much in your head about it.
No, right, exactly. And getting to know your staff. We are there to help. And again, getting there early enough
Early.
to give the staff time, because
Yeah.
your doctor really only has 15 minutes with you. 15 minutes, it's not a lot of time. It goes pretty quick.
Treat it like an airport. You get there
Right.
hours ahead of
Right,
time.
right. You can talk to the
And you
nurse.
beat the rush, you beat the anxiety.
Yep, you can talk to the nurse all day long, but the doctor has, they have to speed up.
Yes.
So.
Well, thank you so much. It's definitely interesting.
Yes.
Didn't know there was a name for this kind of experience phenomenon, if you will. But yeah, thank you so much for coming in.
Thanks for making it in, Christine.
Thank you.
And coming up, we have What's Trending.